This makeshift fever clinic has been set up at a stadium in downtown Beijing. Since starting operation on December the 14th, it provides medical services every day from 10 a.m. to 10 p.m. Most of the medical workers here are from local public hospitals. Some are from Shandong province who came to support Beijing amid this wave of COVID-19 resurgence.
We mainly receive patients aged from 16 to 65 who suffer from respiratory tract infections. Those who have severe underlying diseases or need emergency treatment are suggested to go to hospitals if it's necessary, rather than coming to this simply equipped fever clinic.
As you can see, several tents have been put up at the stadium, and they are used as a temporary registration office, consulting rooms, and a pharmacy. It's freezing cold these days in Beijing, so setting up such a fever clinic at the stadium can shelter patients from waiting in long lines in wind.
It takes me only about 5 minutes to wait in line. I got fever several days ago. Now with the medication, I won't be worried.
My wife, my mother, and I all tested positive. We had fever. I think it might be easier to get cross-infection if I go to the hospital because there could be more people there. So I came here to be prescribed fever and coughing drugs.
Doctors say a week ago when they started work here, they treated patients until midnight. But now they're seeing fewer people.
When we first started operation, there were about 800 to 850 patients coming here every day. But in recent days, the number of people continues to decline. Yesterday, we received about 400 patients. I think this is a positive signal.
Local government says the supply and demand for medical care and drugs is still in a tight balance in Beijing amid the current seasonal influenza and COVID-19 infections. But the capital city is taking measures to increase its capacity to respond.
Latest data shows Beijing now has over 1,200 fever clinics, including those in hospitals and communities. So far, 8 districts in Beijing have transformed public facilities such as theaters and stadiums into makeshift fever clinics to help relieve the burden at hospitals. And all the community health service centers have also set up diagnosis areas for residents who show symptoms such as fever and coughing to seek medical help near their home.